Welcome to your personalized deep dive into the world of CNAs,
CNA,
Certified Nursing Assistants.
right.
You shared with us a training curriculum from California community colleges. And I
Yeah.
gotta say, this is way more than just fluff and pillows.
Oh, yeah.
This deep dive is going to uncover all the crucial skills and knowledge packed into this training. And we're going to be focusing specifically on Module 9.
Yeah, Module 9 really gets to the heart of what CNAs do,
Okay.
equipping those future CNAs to handle all those essential patient care procedures. And the curriculum does not mess around.
Really?
7 hours of theory and a
Mhm.
full 20 hours of clinical experience. So
Wow.
it's very hands-on.
Hands-on is right. And before we get into the nitty-gritty, what really struck me going through all this material is this just the sheer breadth of knowledge that a CNA needs.
Right.
I mean, they're involved in so many aspects of a patient's journey from the moment they're admitted to the day they go home.
Yeah, it's a really holistic approach to care, and you can see that even reflected in the terminology.
Oh, really?
Just the terms, you'll find terms like Trendelenburg and reverse Trendelenburg,
Yeah.
which refer to specific bed positions
Mm-hmm.
that can impact blood flow and can even help during procedures.
It's like you're not just making a bed, you're adjusting it to improve someone's health.
Exactly.
That's fascinating.
Yeah.
How much critical thinking goes into every action.
And then you have terms like excoriated,
Excoriated.
which basically means raw or damaged skin.
Oh, okay.
So it really highlights how CNAs are the eyes and ears on the ground,
Yeah,
noticing things like, skin conditions that could signal a bigger problem.
right.
They're constantly observing and reporting, which is a huge responsibility.
And speaking of observing, let's talk about collecting specimens.
Yes.
I have to admit, I was going through this, and I saw that they use vanilla pudding to simulate sputum
Oh, yeah.
and Play-Doh for stool. And I was like, wait, what?
It sounds
Really?
funny, right?
Yeah.
But think about it.
Yeah.
It lets students practice these techniques
Right.
in a way that's safe and, dare I say, a little less messy than the real deal.
Yeah.
But, of course, the curriculum also emphasizes the seriousness of proper technique and infection control.
Right. So it's like learning to bake a cake before you try a souffle.
Exactly.
You gotta master the basics.
You got to master the basics, and these skills build upon each other.
Okay.
You can see that with bed care, which takes up a good chunk of the module.
So what kind of beds are we talking about here?
We're talking manual beds,
Okay.
electric beds,
Yeah.
all sorts of positions.
Uh-huh.
And CNAs learn to make both occupied and unoccupied beds.
Oh, wow.
So imagine having to change the sheets while someone is still in the bed.
Right.
That requires a whole other level of skill and sensitivity.
That sounds tricky.
It is. It's all about efficiency and comfort, but also about preserving the patient's dignity, which is something this curriculum really drives home.
Yeah.
Yeah.
Okay, and then there's bowel care, which, let's be honest, can be a little uncomfortable to talk about.
Certainly a sensitive area,
Yeah.
but crucial for patient well-being.
Right.
So the curriculum walks CNAs through administering different types of enemas,
Okay.
from cleansing enemas to oil retention enemas, which soften the stool.
Okay.
They also learn about suppositories, which can help stimulate bowel movements.
So we've got enemas, we've got suppositories.
Uh-huh.
Are we sensing a theme here?
Yeah.
It seems like CNAs have to be comfortable handling procedures that some might find, well, a bit personal.
It's true.
Yeah.
It requires a certain level of comfort and professionalism,
Yeah.
but it also speaks to the deep level of trust that patients place in CNAs.
Trust is such a key word here, and it makes me think about the emotional side of things, which we'll definitely need to dive deeper into later.
Absolutely. But before we get there, I think it's worth highlighting another procedure CNAs learn about,
Okay.
and that's caring for patients with feeding tubes.
Okay, we briefly touched on gastrostomy tubes earlier, but it sounds like there's a lot more to it.
There is. CNAs learn about both nasogastric tubes, which go through the nose, and gastrostomy tubes, which are surgically placed.
Right.
And it's not just about knowing how to handle the tubes themselves,
Okay.
but also about observing the patient,
Yeah.
making sure they're comfortable, and reporting any issues to the nurse.
Okay, I'm starting to see a pattern here. It seems like a big part of being a CNA is not just doing, but also observing and reporting.
You're picking up on a key insight there.
Yeah.
CNAs are truly the eyes and ears on the ground,
Right.
providing that essential information that helps the entire healthcare team make informed decisions.
And that brings us to something else that really struck me in the curriculum, the emphasis on meticulous record keeping,
Oh, yes.
especially when it comes to intake and output.
Yeah.
You know, I've never really thought about how much goes into tracking everything that goes in and out of a patient's body.
It's essential for understanding fluid balance.
Okay.
which can be an early indicator of health problems.
Right.
And it's not just drinks.
Mm.
We're talking about even things like Jell-O and ice cream count towards intake.
Yeah. Wow, that level of detail is impressive.
Yeah.
It makes you realize how crucial these records are for monitoring a patient's well-being. We've covered a lot of ground already, but there's still so much more to unpack. So get ready for part 2 of your personalized deep dive.
Welcome back to our deep dive into the world of CNAs.
As we're going through this training curriculum, one thing that keeps jumping out at me is the emphasis on communication.
Oh, yeah.
I mean, we've talked about the procedures and the technical skills, but it seems like being a good communicator is just as important.
You're absolutely right. It's woven throughout the entire curriculum.
Yeah.
From explaining procedures to patients to providing emotional support, CNAs are constantly interacting with people. They're communicating with patients, families, and the entire healthcare team.
It makes me think about, those moments when a patient is feeling scared or vulnerable.
Yeah.
A CNA who can really listen with empathy and explain things clearly, that can make a world of difference.
Exactly. And that ability to build rapport can really impact a patient's trust and overall well-being. For example, when collecting specimens, the curriculum stresses the importance of eye contact and clear explanations. It's about making that patient feel comfortable and respected, even during those sometimes awkward procedures.
Right. I can see how that would apply to something like bed care, too.
Yeah.
It's not just about changing the sheets. It's about maintaining the patient's dignity throughout the process.
Precisely. The curriculum highlights how CNAs are taught to keep the patient covered, explain what they're doing, and just generally treat them with kindness and consideration. It's those little things that can make a big difference in a patient's experience.
Absolutely. So we've talked about communication.
Right.
But another theme that keeps popping up is this importance of observation and reporting.
Yes.
It seems like CNAs are constantly gathering information about their patients.
They are. The curriculum really drives home the point that CNAs are the eyes and ears of the healthcare team.
Okay.
They're trained to notice subtle changes that others might miss, like a slight discoloration of the skin or a change in a patient's urine output.
So let's say you're a CNA and you notice something seems off with your patient.
Yeah.
What kind of things would you be reporting to the nurse?
Anything that's unusual or concerning.
Okay.
It could be changes in vital signs, like a sudden spike in temperature or a drop in blood pressure. It could be difficulty breathing, unusual drainage from a wound, or even changes in behavior,
Like what?
like confusion or agitation.
Okay.
CNAs are often the first to pick up on these red flags,
Wow.
and their prompt reporting can be critical in preventing complications.
It's a huge responsibility.
It is.
They're really on the front lines advocating for their patients.
They are, and that's why this training is so comprehensive.
Yeah.
It equips CNAs with the knowledge and skills to make informed decisions and provide safe, effective care.
Right.
It also highlights the physical demands of the job because, let's face it,
Yeah.
being a CNA is no walk in the park.
Yeah, I was thinking about that when we were talking about bed care and patient transfers.
There's a lot of lifting and moving involved, which can be really tough on the body.
Absolutely. The curriculum specifically addresses this, emphasizing the use of proper body mechanics to avoid injury.
Okay.
CNAs are taught techniques for lifting and moving patients safely, and they're reminded to ask for help when needed.
Right.
It's about protecting themselves so they can continue providing care to others.
Self-care is so important
So important.
in any profession, but especially one that's so physically demanding.
Yes.
And speaking of care, it seems like patient safety is another huge focus in this training.
It is. Patient safety is woven into every aspect of the curriculum,
Okay.
whether it's administering enemas, applying bandages, or caring for patients with IVs. There's a constant emphasis on following procedures carefully
Right.
and being aware of potential risks.
Can you give me some specific examples?
Sure.
What are some of the ways the curriculum emphasizes safety?
Well, for instance, when administering enemas, CNAs are cautioned to never force the tube and to stop if they meet resistance.
Right. It's about recognizing that every action has potential consequences and erring on the side of caution.
Makes sense. What about when applying bandages?
Yeah.
Are there specific safety protocols for that as well?
Absolutely. The curriculum stresses the importance of checking for proper circulation after a bandage is applied.
Okay.
It's about making sure the bandage isn't too tight and that blood is flowing properly to the affected area.
So it's not just about knowing how to do the procedure, it's about understanding the why behind it and being aware of any potential dangers.
Exactly.
Yeah.
And that's what makes this curriculum so effective. It's not just about rote memorization of steps. It's about equipping CNAs with the knowledge to make informed decisions and provide safe, compassionate care.
It really gives you a new appreciation for everything CNAs do. It's
Yeah.
way more than just following instruction. It's about critical thinking, problem solving, and being an advocate for your patients.
And let's not forget the emotional aspect of caregiving. We touched on this earlier,
Yeah.
but it's worth emphasizing. The curriculum acknowledges that CNAs are often dealing with patients who are in pain, scared, or feeling vulnerable.
It must take a special kind of person to be able to handle those situations with grace and compassion.
It does.
You're not just tending to physical needs, you're providing emotional support as well.
You're right. The curriculum encourages CNAs to be empathetic listeners, offering a reassuring presence and a shoulder to cry on when needed.
Wow.
It's about recognizing that patients are more than just a set of symptoms. They're human beings going through a difficult experience.
It's inspiring to think about the impact that these future CNAs will have. They're going to touch so many lives.
They are, and this training is setting them up for success, giving them the tools they need to navigate the challenges and embrace the rewards of this incredible profession.
And a big part of that training, as we've discussed, is that hands-on experience. Those clinical hours are invaluable for putting knowledge into practice.
Absolutely.
Yeah.
It's one thing to read about procedures in a textbook. It's another thing entirely to actually perform them in a real-world setting.
Right.
Those clinical hours allow CNAs to develop their skills, build confidence, and get a taste of what it's really like to work on the front lines of healthcare.
It's like a test drive before you buy the car.
Exactly.
You get a feel for whether it's the right fit.
Right. And it gives them the opportunity to work alongside experienced CNAs and nurses, learning from the best and getting real-time feedback on their performance.
So we've explored the key skills, the knowledge, the emotional intelligence. Is there anything else that stands out to you about this training? Anything that surprised you or made you think differently about the role of a CNA?
You know what really struck me is the way this curriculum balances technical skills with a deep understanding of patient-centered care.
Yeah.
It's not just about tasks and procedures.
Right.
It's about treating each patient with dignity, respect, and compassion. It's about being that steady presence, that advocate, that source of comfort during a time of need.
That's a beautiful way to put it.
Thank you.
It really highlights the human element of this work.
Yes.
The connection between caregiver and patients. And that's something we'll continue to explore in part 3 of your deep dive. And we are back for the final part of your personalized deep dive into the world of CNAs.
It's been quite a journey, hasn't it?
It really has.
We've covered so much ground, from technical procedures to the emotional side of caregiving.
You know, going through this training curriculum, it's clear that being a CNA is about so much more than just tasks and checklists.
It's about being a skilled caregiver, a keen observer, a compassionate communicator, and a true advocate for your patients. It's a multifaceted role that demands a unique blend of technical expertise and genuine human connection.
And I think that's the biggest takeaway for anyone considering this career path.
I agree. This deep dive has really revealed that becoming a CNA isn't just about learning procedures.
Right.
It's about embracing a whole mindset, a way of approaching patient care that prioritizes dignity, respect, and well-being.
It's about understanding that every interaction, every task has the potential to impact a patient's experience,
Exactly.
both physically and emotionally.
And it's about recognizing the power of those small gestures, those moments of kindness and connection that can make a world of difference for someone who is feeling vulnerable or alone.
One thing that struck me is how much critical thinking and problem solving is involved.
Absolutely.
Yeah.
CNAs are constantly assessing situations, making judgments, and adapting their approach based on the individual needs of their patients. They're not just following a script.
Right.
They're actively engaged in the process of caregiving.
And that requires a certain level of confidence and resourcefulness.
It does, but that's also what makes this work so rewarding. You're not just going through the motions. You're using your skills and knowledge to make a tangible difference in people's lives.
You're part of a team working collaboratively with nurses and other healthcare professionals to ensure the best possible outcomes for your patients.
And that sense of teamwork and shared purpose can be incredibly fulfilling, knowing that you're contributing to something larger than yourself, that you're playing a vital role in someone's healing journey.
It's inspiring, isn't it?
It is, and I think that's something we sometimes lose sight of in the hustle and bustle of healthcare.
Yeah.
But at the end of the day, it's those human connections, those acts of caring and compassion that truly matter.
And it makes me wonder, with all this hands-on experience and patient interaction, Do you think many CNAs use this role as a stepping stone to further their careers in healthcare?
That's a great question. I imagine many CNAs find that this experience ignites a passion for healthcare,
Mm-hmm.
leading them to pursue additional training to become licensed vocational nurses or even registered nurses,
It makes sense. You're already immersed in the world of patient care,
right?
building those essential skills and relationships.
And you're gaining a deep understanding of the healthcare system from the ground up, seeing firsthand the challenges and rewards of this demanding but incredibly meaningful field.
So if you're someone who is drawn to caring for others, who enjoys hands-on work, and who thrives in a fast-paced environment, then a career as a CNA might be the perfect fit.
It's a challenging path, no doubt, but it's also one that offers immense personal and professional satisfaction.
Well, I think we've successfully navigated this deep dive into the world of CNAs.
We've explored the curriculum, unpacked the key takeaways, and hopefully inspired you to learn more about this vital profession.
It's been a fascinating journey.
It has. And a reminder that behind every medical chart, every procedure, every piece of equipment,
Right.
there are dedicated individuals like CNAs who are making a real difference in the lives of patients every single day.
Thanks for joining us on this deep dive into the world of CNAs.
It's been my pleasure. Until next time, keep learning and keep exploring.